So with regards to your lower genioplasty complaints, all I said was we're not going to give you an assurance about its improvement.
Right.
There is one thing though that is not very conducive for the way it should be normally, which is that implant, which is a big square implant.
You know what, when you asked me yesterday if it improved after my second surgery, it did, but you know what, I think I said it didn't get worse from my first surgery. I think it did get a little bit worse.
Okay.
Maybe I just didn't notice, or maybe I'm trying to convince myself. So maybe it is a bit of the implant.
So in that case, what we can do is we'll remove the implant. I'll just go inside and I'll just make sure the muscles are in the right place and we close up. It's not a big surgery. So that way,
it won't move scar tissue?
If there is, I don't feel much, like I said.
Oh, I see.
If I can feel a lot of scar tissue, then I'm going to say it's going to be a lot of improvement.
Yeah.
So now since I don't feel scar tissue, but there is an implant that's still inside, and then
Could that be trapping the muscle a bit?
I don't think it's trapping the muscle though, because if I think it's trapping, then I would say that you're going to have good improvement straight away.
That's because you can feel it moving.
Yeah, I could feel it moving, and also I don't like the fact that the implant that's inside, it's not a small one, it's a pretty big boxy, we call it square implant. It's not ideal because it's a long wide like this, so sometimes, you know, see this? It's pretty wide.
But you still don't think it'd be causing my symptoms, you just don't like it for other reasons? Or
I just think that,
inflammation
I just think if you're okay to take a chance in the sense that maybe that there is going to be better, surely not going to get worse, but maybe there's no improvement. If that's the kind of risk or a chance you want to take, I'm more than willing to do that for you. So that's in short the summary for the chin aspect.
There's a doctor, I think I was telling you before, in South Korea. He has a technique where he does resuspend the muscle.
You don't need to do that, I think.
Yeah,
you see, that happens when your lower incisors are shown.
But he says you can still do it even if your incisors are not showing, just to make it more comfortable.
Okay, I can do a pexy. I do a pexy another way. I can
Would
do
that
that.
cause any aesthetic problem?
No, it's going to only look better.
So it wouldn't push my...
I don't suture the muscles onto bone, but I pexy the muscle onto muscle. So what I technically...
What does that mean,
pexing is tightening. So what happens, for example, this is full muscle. So as I go inside, I keep a little bit of muscle, like a wafer, like a strip, onto this part of the lip while I cut. So later on, when I suture, I can pull the muscle and suture it up to the muscle above. It's like a sling.
What he also does, he gets for a bandage for like 2 weeks.
Yes, you can wear it even.
He's very serious about that because it can heal in the wrong place.
Yeah, you can do that.
I'm willing to do that too.
So that's fine.
Even just to take, even if you're not sure. Just
But remember, all of that is mainly to prevent a chin ptosis, to prevent lower incisal show, not really for your complaint, which is tightness after 2.5 years of surgery.
I'm just so flabbergasted and confused how there's nothing you can find that's causing this because
no, but I mean
it's just have the ptosis have what I'm having too, and I just don't understand what it maybe it's fibrosis hitting in the tissues more discreetly. I don't think my chin's too far. I don't think it's
it's not too far.
Yeah.
But you just had 6 mm of advancement. There's no reason on earth why you should have this complaint in the first place.
It was pulled back with the chin wing, right?
Yeah.
It widened it and then blunted it.
The chin wing basically doesn't bring it forward at all. It just widens it.
Yeah, and
so
it also brings us back Richardsons.
Yeah.
I noticed that too. So that's why I was worrying about the aesthetic, but I don't think I want to.
Yeah, I would. See, I don't think you should now remove the implant and make another osteotomy. Not a good idea at all. Simply because your primary complaint is the tightness and the fact that you're not able to carry on with your normal activities, even as basic as speaking. Now, with that being a major complaint, which is a functional aspect for a cosmetic procedure, I don't think I'm going to be happy. I would not want to do any osteotomy or any genioplasty per se again. No, that's a big no.
It could put more tension.
No, that might just go from the frying pan into the fire. I'm not going to do that. So what we can do, however, is this. But you understand very clearly that I'm not giving you 100% assurance. I'm not even giving you 90% assurance.
20% like improvement, or is it?
Yeah, I think you can have an improvement. That's the thought process that you should have. You're going to take
I think
this
if
thing
you're
done.
willing to suspend this higher, because
I would do that.
with Dr. Cook. So
That's fine. That's a very much normal procedure for every revision genioplasty.
So he agreed with you. He said, I don't have my lower scissors are covered. They're not showing. So it wouldn't help me as much. But he says it would still help me.
Okay.
And he says there might be something blocking it here. I don't know. He said maybe scar tissue.
No, I would do all of that, but remember that even after that, you still might be having this complaint of tightness 6 months after we do the procedure. And I don't want you to be upset at that point in time, because that's the important thing at the end of the day.
Yeah, I understand. It's a risk.
There is a small amount of risk. I wouldn't call it risk because it's something I don't know the exact outcome. Not every time in medicine we know 1 + 1 is 2. Sometimes we do not know. For some it's 1.5, for another it's 2.5. It's not that precise science, especially healing issues with how long it takes. For example, in your own case, it's absolutely rare. And hence, you have to be understanding that much.
Yes.
That's it. As long as you are. And also remember, once you do things in good faith, once you know that, we're just trying to sort out, very often good things happen in life. It's not that everything you do with guarantee, because sometimes we do not have it. Absolutely. And that's one of the situations.
I feel more comfortable you looking in there than any other surgeon, maybe Dr. Cook as well, because you've done this before and you know
many times.
So maybe you might see some, but I'm not, honestly, I'm basically expecting no improvement if I do it. And
I also gave you in the last consultation, if you remember, the percentage of patients that had similar complaints that didn't improve and that improved also. I told you that as well. That's just for you to understand that still, like I would think that in about 60% of the patients or 50%, there is going to be some improvement.
Even if you can't feel it? Or only when you can feel it?
When I feel it, 50 to 60%. When I don't feel it anything with my hands, it comes down a little. Well, now if it's 0, I would say don't do it. So then I would say no surgery, like how I'm saying no genioplasty for you.
So I'm just going to ask you.
It's going to be much lower, 20-30% probably, if you want a percentage wise.
Have you helped the person where you couldn't feel it? And
yes.
You have?
Yes.
Okay. Well, in that case, then.
But then the only thing is that in that case, then they sometimes even tell me after 6 months, Doc, you know what? I still feel the same. That's a small risk you will have to take.
Maybe the muscle slides down. Dr. Cook gets you to wear like this bandage for 2 weeks, even a month.
No, but really that's not the solution for this, because that's for a chin to prevent drooping. You do not have a droopy chin. So there's no point doing a solution for a problem that there isn't. So now the thing is different. So if you want me to do, so what I'll be doing is, I'll be making an incision by keeping the muscle a little bit on the side of the bone, and then we will be removing the implant. I will free up everything. I'll have a more direct view. If I find any scar, if I find anything that I think is not fine, I just fix that. We close up. That's it. That's the best we'll do.
And here,
those are straightforward. We can remove them.
And do you think that would stop the bleeding?
Very good chance. Very good chance. Because those screws are into the sinus, and the sinus is infected. The sinus membranes are enlarged.
So I sent you a message. My surgeon who did the surgery said he would remove the mucosa.
Yes, I'm going to do that. Of course.
Okay, you would do that because you have very bad sinus problems like that.
I have to do that. There's no point just removing the screws.
Okay.
So as I remove the screws, because the screws have gotten into the sinus and have caused the sinus infection, so to say the sinusitis with enlargement of the mucosa, the Schneiderian membrane technically will remove that. So that's why I'm saying that's going to be a perfect improvement for sure.
Okay. So when do I have to decide? Are you thinking of doing the surgery today?
Oops. Today may be difficult.
Well, I think what your assistant had said maybe even today, because she asked me if I could eat anything. I wasn't.
I actually don't know my schedule for the day, because they told me that I have 2 long surgeries for today, and you weren't in that list.
Would tomorrow be?
Tomorrow, absolutely possible. Today may be a little risky because I don't
think I want to. I want to think about it a little bit more.
And also because I have 2 cases scheduled for the day already. I think it might be better that I do first up for you tomorrow.
Okay. So do I sleep here overnight, or do I come in the morning?
No, you come in the morning.
Okay.
It's going to be more comfortable where you're staying elsewhere, at the hotel.
It's not a long surgery, so you don't.
No, it's not going to be long. That's a good thing. because we're not going to be doing any osteotomy, we're not going to be doing anything much, we're just going to be taking off those plates and screws, seeing what it is and remove all of that and some sinus work. I'm still thinking it's probably going to be like an hour and a half to 2. It's not going to be like a 30-minute procedure. About 2 hours, a little less than 2 hours.
Okay, that's not short. Okay, so when could I let you know by? I just wanted to think about it for another couple hours. And
yeah, you can just let my manager know the timing. You can tell Richard no. I mean, and then if you let me know even by 5 p.m., then we can easily have you up tomorrow morning. Okay. So that we need also to, I think, do your bloods and ECG and other things, right? We haven't worked you up.
I did do blood work in Canada. I was thinking about...
but we would just want to do it here.
Yeah, I did a bunch of HIV and a bunch of blood counts.
We'll just run all of those through. That's just part of our requirement. So we just do that. That's not going to... Yeah, we can do that in 20 minutes. It's not a problem. They'll just get that done for you. And I think...
swelling? Because I saw
it's going to be there will be swelling.
No, but so long as my surgery was a year ago, and I feel like I still do have some swelling here. It just seems like edema, like.
So this is related little bit to your sinus issues as well.
I think so, yeah.
But I'm not again going to be very sure if that swelling is going to come down. But definitely your sinus issues will come down.
Okay, and that's good. That's good enough. I mean, if it's swelling due to some other reason, I can't.
Yeah.
So you don't think there'll be any bone grafting needed?
No, I don't think it should be needed.
And how come you don't think so?
On the scan.
On the scan, okay.
It's just I'm just thinking it's on the scan. I don't need any bone grafting.
Okay. Because I was thinking maybe the.
And another thing, remember when there's infection nearby, you see when there's a sinus infection, which is what you're having because of the screws that have gotten into the sinus. Now there's infection there. When I'm dealing with infection, I can't put bone graft because the graft also will get infected. So that's also a no-no. So you can't do any grafting at the same time when you're dealing with some infection.
And you don't need to put the bone graft.
I don't think so. I need to.
As long as the blood is probably.
Your upper jaw is firm, so I don't think it's needed.
Okay, we're done. Okay, sounds good. So I'm probably going to say yes. 95%.
We always with this percentages actually.
Yeah.
That's nice. Anyway, so I'll do let us know.
Will do.
And I can show you here once more if you do want to have a look at your sinus, if you can see. Now, very, very classical. This is your sinus, okay? The dark color, that's the air. This is your nasal passage and this is the sinus. For everyone who doesn't have a sinus issue, this entire thing is going to be this dark.
Really? Oh, okay.
Yeah. You see the light, the darker it gets, the lesser the bone. The brighter it gets, the thicker the bone. So this is the screw, the brightest.
I see, yeah.
And this is the sinus, all inside.
So it's right there.
Inside, right inside. And this is the mucosa, which is supposed to be this much. I can tell you.
It's supposed to be black right here.
It's supposed to be black. And the mucosa and the sinus is, I'll tell you how many. It's swollen by 1 centimeter. Yeah, it's not something small. So I have to remove all of this. Okay. There's no way we do anything else to this. So there's a similar thing on this side also. This side is even more. About the same, but it's the same. And if I make if you keep seeing see that everywhere the sinus, it gets slightly better there. It gets worse here. That's the sinus. This is another sinus. That's your frontal sinus, ethmoid sinus. Those sinuses are here, but we're just talking about the sinus that's here in the upper.
Is that my right side or left?
So that's the right side.
Yeah, I have more swelling on this side too. I also have pain when I chew on the right side. I don't know if you can fix that. Probably can't. But
and also there is something like a bony piece or something into your sinus. A bit of it on both sides.
That might be causing the pain because when I bite, I feel like a sharp pain that kind of radiates up here. If you can see anything, maybe just.
Yeah, there is something not happening right with your sinus very clearly, and I'm just showing you that exactly. This area, all of this is infection.
And the results from my osteotomy won't relapse by removing the screws. It's been a year, so.
I don't see that happening.
Yeah.
I don't see that happening.
Is it possible?
No, I don't think so.
Not
because you have good fusion in other areas. It's like the jaw is like this, and you're having an issue in about 1 centimeter area. The rest of it is fine and healed. So we're not going to disturb the other areas that's fine and healed.
I can just see the skull, like where, like if we remove the screw, what the potential, like if we remove this, could anything happen to the cheek?
I don't think it should. I think it's all should have healed up now.
So there's a gap here, right?
So they've put a graft here and I've lifted the cheekbone there. And I think this gap should have healed. So if I think on the clinical, on the scan it looks fine.
Yeah.
But if there's a problem, I will not remove the...
If you think so, yeah, if you think there might be relapse, I would. Because
I'll only clear the sinus.
Yeah, the sinus ones were the big problem.
Big
I don't
problem.
think these are...
See, these are not our concern. This is just holding the zygoma onto the upper jaw. We are talking about the screws that are gone into the sinus. So I'll just focus that.
Okay. But if you think you can remove it without a relapse, then...
I can remove that as well, yeah. Fine.
Is in orthodontic surgery, when you like remove a screw after a genioplasty, is there typically relapse?
No relapse.
There's not.
Nothing, because the bone is healed. It's already fused.
Right. So screw has nothing to do with that.
It's all healed.
All right.
All right, Aaron.
Well, so thank you for your time again.
No, pleasure. I'll see you tomorrow maybe.
Yes.
Anyways, let my guy know and... Sorry, Richard actually could to pay. Let us fast up.